Hi, it's Dr. Elisha Van Dusen at New Hope Chiropractic. Why are muscle relaxers not the best overall, especially long-term strategy for dealing with back pain and headaches and neck pain? That's a question I get a lot of the time. And as a natural healthcare practitioner, as a chiropractor, I push people away from taking muscle relaxers, taking pain pills. And here are some of the reasons why a natural approach like chiropractic care is better than using muscle relaxers. Muscle relaxers really should not be taken for longer than 3 weeks. Side effects of muscle relaxing drugs are common, and they include things like drowsiness, dizziness, dry mouth, urinary retention, which is an inability to completely empty the bladder, fatigue, weakness, and also addiction. Some muscle relaxers can also cause acid reflux. So in more extreme cases, and when muscle relaxers are abused, they can cause heart failure and paralysis even. That's some pretty heavy stuff. Due to the side effects associated with muscle relaxers, people are advised to not drive or operate heavy machinery after use, and it's typically advised to take them before going to bed. Those with a history of drug or alcohol addiction should not use muscle relaxers, and they should also never be mixed with alcohol. Carisoprodol or Soma should especially be avoided because it's associated with a high risk of abuse and addiction, and it's really not seen with other muscle relaxants. So it's an especially bad one, especially dangerous one. Conventional muscle relaxers should also not be taken by older adults, pregnant women, or anyone who suffers from depression or a history of drug or alcohol addiction. And that's why it's so much better to take natural muscle relaxers, and prescription or over-the-counter muscle relaxers have many more harmful side effects in addition to being highly addictive. So instead, heal your muscles and relieve pain with natural, healthy substances to avoid these pitfalls, and that'll help relax your muscles for the long term, because muscle relaxers can also be addictive. In the US, as well as other countries, muscle relaxers are a commonly abused substance. The problem is that these muscle relaxers can be so fast acting and effective at pain relief that people with chronic pain easily become addicted to them. Addiction often develops when muscle relaxers are used habitually as the main or only method of pain relief. So the number of people winding up in the emergency room because of misuse or abuse of prescription muscle relaxers like carisoprodol has more than doubled in recent years. The U.S. Food and Drug Administration recommends that patients take muscle relaxers only for limited periods of time, 2 to 3 weeks maximum, and I would argue even less than that, especially as a chiropractor, when there's so many more effective means of dealing with pain and tight muscles, like chiropractic, for example. When some muscle relaxers, like Soma, for example, are ingested, they're converted by the liver into a chemical with anti-anxiety properties. This means that even when taken on its own, patients run the risk of developing a physical and or psychological dependence on these drugs. Also, the use of other pharmaceutical drugs in conjunction, the body becomes used to a daily intake of a muscle relaxer and is then dependent on the drugs in order to function normally. If a typical dose is skipped or intake is stopped altogether, the person is likely to experience withdrawal symptoms, and you can also build up a lot of liver toxicity with muscle relaxers. They become even more problematic and risky when they're used in combination with alcohol and other drugs. And this tends to magnify the negative side effects. So if you're in pain, if you have tight muscles, I encourage you to take steps, seek remedies that are natural and holistic, like chiropractic care, for example, and better diet and anti-inflammatory diets, and get it taken care of that way, because it's much more effective and much simpler, and it doesn't run the risk of addiction. And if vertebrae in the spine or joints in the body, the spine and the extremities are out of place, no muscle relaxer, no amount of pills is going to put that bone back in place and restore the function of the joint. Only a specific chiropractic adjustment can do that. So visit us at newhopechiropractic.com for more health information and to book an appointment to get your spine checked and get your problems taken care of, and we'll be happy to help you. So with that, I hope you have a healthy day.